did Cody Garbrandt lose UFC 255 before it even began?
Bro, what are you talking about, man?
Today, I'm looking at how Cody NoLove Garbrandt lost UFC 255 before it even began. Although the pay-per-view event has not even started yet, NoLove has already been eliminated almost 6 weeks before the event. In this video, I will discuss how and why he has been taken out, what it will mean for his future, and when we can expect to see him back in the octagon.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you are here because you recently subscribed to my channel, then thank you for becoming a part of the intern army. Now, 59,000 strong. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. If you're interested in sports injuries and how they happen, then this is the channel for you. So subscribe and hit the notification bell so that you don't miss any of my content. Follow me on Instagram or Twitter for medical stories and content, TikTok for information on medical education, and on my other YouTube channels for my podcast or for workouts and training tips. Now, let's get to the video. So today, I'm reacting to the recent news of Cody Garbrandt being removed from the UFC 255 card scheduled for November 21st of 2020. He was scheduled to contest the flyweight championship against Deiveson Figueiredo in the main event on the card. It was supposed to be Cody's first fight in the flyweight division after previously holding the title in the bantamweight division. He reported on October the 3rd of 2020 that he had suffered a biceps injury while training. He further stated that the UFC had elected to replace him on the 255 card, but that he would be guaranteed a title fight upon his return.
Okay.
How did he injure his bicep? How will this injury be treated? And when can we expect NoLove back in the octagon? Garbrandt had recently had COVID, and as a result, he had not been able to train for a period of approximately 6 weeks. During that time, he had cycled to maintain cardio, but had not done anything else. When he first returned to training, he noted some soreness in his right bicep, although he did not recount a specific injury to his right arm. Typically, injuries to the bicep occur after uncontrolled eccentric load on the bicep tendon. In other words, the elbow is forcibly extended when the biceps is actively contracting. However, Cody did not report this type of injury. The soreness that he was experiencing continued over the next several weeks and increased in intensity as his pre-fight training became more rigorous. After a day of 2 workouts, his pain had increased, so he went to bed noting that his arm was tight and sore. He awoke later in the evening with his arm swollen and in excruciating pain. He called his coach and canceled the day's training. Thinking that he was suffering an infection, he sought the attention of his physical therapist. His therapist performed a diagnostic ultrasound that revealed that Garbrandt had suffered a distal biceps tendon rupture. Garbrandt reported on social media that he had suffered a grade 3 tear in his distal bicep.
Went there, did an ultrasound on it, and saw the tear. So
this represents a complete tear of the biceps muscle or the tendon where the muscle has been torn through its entire thickness. Clearly, this is not a good thing to happen less than 2 months before a championship fight. Garbrandt reported that he consulted with a surgeon before speaking to the UFC.
I went and saw a surgeon yesterday, waiting to get an MRI to see anything else is damaged.
Although he told the UFC that he would need approximately 5 weeks to recover, the UFC decided to replace him on the UFC 255 card with another fighter also preparing for a separate fight on that same card. Garbrandt stated in an interview with Tim Bissell of the Bloody Elbow that he had consulted a surgeon following his injury. Given the time frame that Cody had cited required for recovery, it would appear that he had considered non-operative treatment of this injury, as a 5-week rehabilitation after surgery would be inadequate for full recovery and aggressively ambitious. Non-operative treatment is a treatment approach that could be considered for tears that had occurred at the musculotendinous junction, the location where the muscle fibers transition to tendon tissue. With these tears, surgical treatment is more difficult since the sutures used cannot achieve really good purchase in the muscle tissue the same way they can in the tendon tissue. It's kind of like sewing steak. However, as a professional athlete, it would be more favorable for Garbrandt to opt for the surgical option of treatment. In fact, it is fortunate for Garbrandt that the UFC took him off the card and promised him a crack at the title shot upon his return to the octagon. This gives him the time that is required to have the injury treated surgically, if necessary, and rehabilitated before returning to fight. Whether his injury was treated surgically or non-surgically, 5 weeks would have been an exceedingly short timeline that would have taken the focus of his pre-fight training away from the fight and toward his rehabilitation. Not ideal before a championship fight. As yet, it is not clear how Garbrandt had his injury treated, although I would imagine that he opted for surgical treatment, especially if the tendon was injured at the level of its insertion in the forearm. A post on his social media shows him using a cold therapy compression unit, which is often used after surgery to control postoperative swelling and pain. This leads me to believe that he has had the injury treated surgically. However, I have not seen an incision or any specific confirmation of this, so it remains to be seen whether that is actually the case. If you're interested in learning how these injuries are treated surgically, you can check out my video on the bicep injury the WWE's Rezar suffered and its subsequent treatment. I'll leave a link in the description down below. Either way, we can expect Garbrandt to allow a time frame of approximately 6 weeks to allow the tendon to heal before he starts rehabilitating in earnest. After he starts rehabilitating, it will take another 6-week period for Garbrandt to fully restore his range of motion and strengthen his affected arm. At this point, Garbrandt may be able to return to the octagon, but it is likely that he won't be in optimal fighting form. Already at this point, we are looking at 3 months, which puts Garbrandt well into the new year before he returns to the octagon. Although he is a gamer, if he wants to be at his best for this match, he should take the time necessary for full rehabilitation. I would expect this to take closer to 4 to 5 months, but only time will tell. So what do you think? How long will it take to see Cody NoLove Garbrandt back in the octagon fighting for the championship belt? Be sure to let me know in the comments. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.